Hello, my name is Dr. Stanley Lang, and welcome to this Hangout. The topic is chronic stress management, and my question for you is why should we heal or manage stress? Why should we try or even bother to heal or manage stress? And I guess first of all, we have to define what we're talking about when we talk about stress. All of us kind of know what stress feels like, but one way to define it, which has been really helpful for me over the years, is to say that stress is caused by, or it is actually the experience of, what we call a gap between our expectation and our reality. So we call this the expectation-reality gap. And so this is chronic stress as opposed to acute stress. So acute stress is something like you're jogging down the road and all of a sudden a big dog starts chasing you and you fear for your life. You're able to escape up a tree, and eventually the dog owner grabs the dog, takes the dog away, and you escape with your life. And during that moment, you had a lot of stress, but um, the stress went away because the dog went away, and you were no longer threatened. Well, now let's imagine a scenario that every day you have to walk by a place where this big dog is going to chase you. It's going to chase you for at least a block before you get away, and every day you know this is going to happen to you. Well, pretty soon you're going to start feeling what we call chronic stress because you don't want to be there. This dog is going to chase you. You fear for your life because this dog is going to chase you, and there's a big gap between where you want to be and where you really are, and that gap is the chronic stress gap. Now, for the purposes of these next few hangouts, I'm going to ask you to assume we can't change the gap. We're stuck with the gap. So what do we do with our situation when we can't change the gap? All of us have some of this chronic stress. All of us have a gap between where we want to be and where our reality is. So what are you going to do about it? We call the doing about it stress management. So what kind of stress management are you going to do? How can you approach stress management? So one of the things that I want to suggest to you is that the best way to approach stress management is through a whole person approach using physical, that is body-based, emotional, that is mind-based, and spiritual strategies to help you control or manage or heal your stress. And so what I want to think about today, or encourage you today, is something from the physical realm, the body part. So all of these other areas are important, and I know that you know that they're important, but I want to focus on one thing today so that you have a take-home message. So my suggestion today on the physical realm is simply to get moving. Walking is the best example of getting moving. Now, why do I make that suggestion as a strategy for chronic stress? Well, the reason is that physically, when you start moving vigorously and you sustain that for 20 to 30 minutes, it causes a chemical reaction in your brain, and two very important, probably more than two very important chemicals improve in the brain. And these improvements actually help you feel less stressed. And those chemicals are endorphins and serotonin. You may have heard of those words. They're just names, but they're very important chemical signals in the brain, and they both get better when you move vigorously. And the good news is that it doesn't cost much to move vigorously. You can move vigorously doing a lot of different things. Statistically, the best thing is to do a walk that starts at your front door and ends there, and that's what I suggest for most of my patients to do when they don't have anything else lined up. So you may not know this, but walking vigorously has a 90% cure rate for depression. A 90% cure rate is way higher than antidepressants cure rate for treating depression. And why is that? Well, it's because of those chemical changes in the brain that I mentioned. So if you get a 90% cure rate of depression, you're going to get at least that much of an improvement in the perception of chronic stress if you move every day. So I encourage you, as the best thing that you can be doing right now from the physical realm, the simplest thing to deal with chronic stress, again, assuming that you can't get out of the situation, is you need to find time to do the exercise. Something simple, 30 minutes. You need to find time to do that. You need to make it in your day, and you need to just create that time out of the day that you have and do it. And if you do that, you will have a lot less experience of that reality and expectation gap. And the gap's still there, but how much it weighs you down is going to decrease a lot. So I encourage you to do this on a daily basis if possible. And if you found this encouragement helpful, I do ask you also to share it with friends and family and to subscribe to this channel. I wish you well, God bless, and success in your stress management. Have a good day.